Hello, Palsy here. Happy Monday. I hope if you are dealing currently with facial palsy that you have found the right information and the right kind of help in order to find out what to do exactly to make progress. In that regard, I just wanted to remind people, I get asked this question quite often with when should I start facial therapy? The reality is with when you're first diagnosed with Bell's palsy and early on, if you see quite a bit of rapid progress, maybe from 1 week to another, your face has regained like half of the movement, that means you're in pretty good shape. And the chance of you requiring help is you probably won't. That is if you are able to close your eye. Closing your eye should be your priority, and if you still struggle to close your eye, there's a lot of things to do initially to help you with this. And this is what I do with early onset patients that reach me or either sent by their doctor to see me. There's a lot to do actually in regards to learning the proper technique to tape your face, to support your face, as well as to close your eye at night or during the day. There are several techniques that can help you with this, and that can really alleviate your symptoms and really help with that eye closure in order for your eye to not get more irritated. So besides the taping and those techniques to stretch your eyelid, there is also some technique to massage your face, as well as to perform some targeted stretches if your opposite side is actually working too hard, since it is the only one mostly working at that point. There are things to do. So these are all things that a facial therapist can help you early on during your facial palsy journey. And I would really encourage anyone to consult. I see a lot of people initially like this that struggle, and then they end up progressing fairly quickly. And all they've needed was maybe one or a couple appointments, and after a month, they've regained some movement and don't need my help anymore. On the other hand, some people struggle for a much longer period of time and will require some ongoing care in regards to what to do and at what time and during which timeline, and possibly dealing with synkinesis later on. But facial therapy is not